Welcome to Inflammatory Arthritis and its Treatments. My name is Carolyn Wiskin. I'm a clinical pharmacist specializing in rheumatology from Hamilton, Ontario. I started working in rheumatology about 30 years ago, actually, as a rheumatology pharmacist in the Rheumatic Disease Unit at St. Joseph's Hospital. Since that time, our treatments have changed a lot, and it's exciting to see the difference that we've made in people's lives. I've been happy to do practice research, looking at the impact of a pharmacist-led education visit before treatment decision is even made. I've also had the opportunity to develop many continuing education programs, both for patients and other health professionals, working with various pharmaceutical companies and presenting at conferences across Canada and internationally. It is a pleasure that I can bring this program to you. When I think of an autoimmune disease, I often compare it to the Coast Guard. In the case of the Coast Guard, we have boats that survey the water. They're looking for trouble. Is there somebody in distress? And when that's identified, a signal, often a radio signal, is sent back to the head office on the shore, and then the head office decides, yes, I'm going to respond to that and send a team and get some help for that distress signal. Well, in the body, we don't have boats, but we have cells that survey the body called dendritic cells. And these cells are looking for invaders, bacteria, viruses, cells that don't belong, that could be seen as a threat to the body. And when they identify that, we don't send a radio signal, but we send a chemical signal into head office. And the head office cells in the immune system are called T cells. T cells and B cells, they both work together. If they feel that this signal is worthy and there's actually a threat to the system, an infection that is dangerous, then they will generate inflammation in the area where that invader was identified. And that is sending a signal, a warning to us to sequester that infection, to prevent it from spreading. And it's actually a way that the body's making inflammation in a healthy way. So the immune system making inflammation at the site of an infection has a purpose. It's a warning to us, and when the infection's gone, the inflammation's gone. It knows how to resolve. But the immune system making inflammation in our own tissue, the immune system getting signals saying, hey, there's a threat or a problem in the joint lining, such as in rheumatoid arthritis, and then making inflammation there, well, that's not a healthy role of the immune system, because now we're making inflammation in a spot we don't want it. It has no purpose, and in fact, over time, it's going to cause damage and destruction to that tissue. So inflammation made for a purpose knows how to resolve. That's a healthy function of the immune system. Inflammation made that doesn't have a good purpose, that doesn't know how to resolve, causes damage in our own tissue. That's not what we want to happen. You may wonder, why is it that in some families, identical twins, one could have an autoimmune disease and one not? It certainly isn't just the genetics. It's the environment that person is in. So the genes play a role, their environmental triggers can play a role, and how the immune system regulates itself. So when someone has an autoimmune disease, it's really a perfect storm of a few factors all coming together at once. So what are the environmental factors that could impact the likelihood of you developing an autoimmune disease when you have the right genetic background? We've identified for some conditions, periodontal disease and even cat bites could be a trigger to the start of their condition. Certainly smoking is something that infects all of our autoimmune diseases. People who smoke have greater likelihood if they have that genetic predisposition. Stress plays a role across the board, not just in the likelihood of developing an autoimmune disease, but certainly flares are greater at times of stress. And then there's that gut biome. Certainly that good healthy bacteria in the lining of the gut plays a significant role in the body, and alterations to that good gut flora can make a difference in terms of triggers for autoimmune disease. And certainly injury. Not does injury just produce stress, but physical injury can cause healing that takes its own pathway, where inflammation starts to be made from the immune system, not just the normal inflammation we would see from an injury itself. Not all the environmental triggers shown in this slide apply to everyone or apply to every condition. We're yet to know what many of them are. But I think one of the most important things we can all say is if we are a person who has an autoimmune disease and we're worried about how genetically we may pass it on to our offspring, that living the healthiest lifestyle with good nutrition and non-smoking would be important. So when we sort of summarize this section of what is an autoimmune disease, inflammation being made in excess in the wrong tissue, driven by the immune system, is what it really is about. And where that inflammation is what really determines which condition you have. So excess inflammation in the nerves, for instance, would be someone with multiple sclerosis. Excess inflammation in the gut lining could be Crohn's or ulcerative colitis, or excess inflammation in the skin, psoriasis. The same basic process is happening.